Hey everyone, Britta here. If this is your first time here, I'm a spiritual life coach, and what a video to start with. This is kind of a not the normal type of video, but I wanted to let you guys know why I haven't been posting. Now I know you guys know that I've been working on my program, but I actually had surgery and then caught COVID. So I wanted to explain, number one, why did I have surgery? Was it an emergency surgery? No, this was planned. This has been in the works for about 5 years and finally was able to make it happen. I had gastric sleeve surgery and I have PCOS. If you're not familiar with PCOS, it's polycystic ovarian syndrome. And it messes with your hormones, essentially. It causes you to gain weight and a myriad of other symptoms, which I'll list right here. One of the biggest things with PCOS is that it's very easy to gain weight, very difficult to lose weight, which of course weight causes a lot of other health issues. I was pre-hypertension, I was pre-diabetic, because one of the big things with PCOS is it causes insulin resistance. Up until about 5 years ago, I didn't even know what PCOS was. And this is when I was getting ready to marry Stan. I was a general manager at a gym, Anytime Fitness, and I was working with the trainers. Now, one of the trainers, her name is Gina, and she was so funny. She was amazing, and I was so proud of her for this conversation. So she was getting up and meeting me at the gym before we had to actually clock on and work 4 days a week, I think, 3 or 4 days a week. And so she knew I was doing the workouts because she was doing them with me. So when we had been working out for exactly 6 months and I had lost, I think, like 5 pounds, and my body fat percentage went down like 1%. It was very minimal movement. She, even though I was her boss, she had a conversation with me, a hard conversation. And as a trainer, I was so proud of her for this because she needed to do this. She told me I either need to go to the doctor and get checked out, or I was lying about the foods that I was eating or the sleep I was getting or the water intake. So I knew I wasn't lying. I knew, as far as when you think about getting in shape or having a healthy lifestyle, you have all the little boxes that you check, right? So you've got getting enough sleep, getting 8 hours of sleep. You got drinking X amount of water. You've got eating healthy, non-processed foods, right? I'm checking all of these boxes, had been doing that for 6 months, was working out with her so she knew that that part was getting done. And I had very minimal weight loss. Because of that, I took her advice and I went to the doctor, and they took so much blood. They did a whole ton of different tests and found out that I have PCOS, which is polycystic ovarian syndrome. Now, because of all of the symptoms, I had been experiencing them since puberty, but I didn't know that they were all related, because this isn't something that you're really taught. This isn't something that my gynecologist talked about. My mom passed away before I had kids, and everybody says that after you have kids, things just change. They never go back to the normal. So I didn't really have anybody to ask questions to compare like our family history with. So I just assumed that a lot of those symptoms were because I had 2 kids and I had them back to back. What actually was happening though is that my body was telling me a story. And that story was that there was something wrong. Another one of the symptoms of PCOS, because it has to do with your hormones, is depression. And I have had depression literally since puberty. When I was younger, of course, you have all of those hormones that are going on with puberty anyway, on top of PCOS, that I struggled a lot with suicidal thoughts and self-harm, which I've talked about in other videos on this channel as well. So it's like the more I learned about this, the more sense it started to make. Now, 5 years ago, when I found out about PCOS, the very first treatment option that my doctor talked about was gastric sleeve. Remember, I was a general manager of a gym, and I've always been the type of personality that I like to lead by example. So how could I ethically have this surgery when it's my job to talk people out of having this surgery and to sign up with a personal training package. There was so much judgment and so much guilt and shame just around the weight already, let alone the job that I was doing and what I felt like that would look like. I felt like that was cheating. I felt like getting that surgery was the easy way out. Foreshadowing, little did I know. But back then, I didn't want to go down that route. I was like, what else can we do? What else can we do right now? And she said that we could do hormone therapy. Well, again, Stan and I were just about to get married and we were blending our two families together. And the last thing I wanted was for my soon-to-be bonus kids to have our households come together. They're already having to share their rooms with my kids and there's so much adjustment going on. I didn't know what hormone therapy would do to me, and I was really afraid that it was going to make me like have a really short fuse or be depressed, or like I didn't know what it was going to do. So I said, is there anything else that we can do? Like, what are the options? So she put me on a couple different medications. They didn't really do anything. And I adapted a vegan diet for maybe 2 years, give or take. And the reason that I ate vegan is because my body was already having so many issues with the hormones that I had, that introducing external hormones, even if it was organic, was just, it was like, just give your body a break, right? There's already so much that it's dealing with. Let's not bring in external hormones to try to balance all of this as well. So I did that. Again, I'm not even gonna say moderate results. Like, I really didn't see much results. I could maintain, and that was really about the best that I could do. Now, fast forward to 2019, and I'd exhausted all of these other options, all the medications. I did have a minor procedure done, which was terrible, extremely painful, and that didn't do anything. And there's a lot of like, let's try this and then wait, because it has to do with hormones and your body takes time to adjust and to level out. And so everything that we tried, then we had to wait like 6 to 9 months and then see how it did. So it's been a long process. And then finally, I tried the hormone therapy. I wasn't ready to do gastric sleeve just yet, but I was like, okay, let's try the hormone therapy. And that wrecked my body. I don't know if you guys look in the past videos and you look from a year ago in 2020 or even 2 years ago, 2019, up into current, and you just look at the thumbnails. You can see the difference in my face and my chest and my shoulders. I don't really show full body because there was so much shame with what my body looked like, to the point where I didn't even want to make videos. I didn't even want to be on camera. And I'm still been doing my one-on-one coaching with my clients, but even that, again, I want to lead by example. And as a coach, we want to hit all of the aspects: mind, body, spirit, the Trinity, and the balance. And that's what I'm teaching people, right? And so this is just how I felt. This is not the way that it really was, but it's part of imposter syndrome, right? And we all experience imposter syndrome. And for me, it was like, how could I coach people to have balance and to do shadow work and to heal trauma if I'm sitting here not even overweight, but obese? And it was really difficult for me to give myself that grace and love. And I tried to be patient and to feel out the hormone therapy and to let it do its thing. And, I knew, unfortunately, my doctor was telling me that this is really gentle hormone therapy. It was like the lowest dose that they could do, and that it wasn't going to cause breakouts. It wasn't going to cause weight gain. It wrecked me, y'all. It wrecked me. I gained at least 50 pounds between 2020 and 2021. I lost my job at the gym. It ended up closing their doors for good, unfortunately. And I just focused on my coaching business, and as y'all know, building this program that I'm doing for entrepreneurial moms. But I still had a hard time showing up. And we had decent savings here in the States. My insurance, which is probably similar to most insurance, you have to really fight for this. And although this has been a 5-year journey, because I didn't say I wanted it from day one of 5 years, I was trying to try everything else that I could. This was the last resort. We didn't get the ball rolling with insurance. And so we would have had to really fight for it for insurance. But my insurance was like, they didn't care that it's PCOS. They don't care that the weight gain is a symptom of many, one of many. They just see weight loss surgery and they're like, nope, we don't cover it. We don't cover anything having to do with weight loss. So to get that surgery here in the States, it's about $22,000 to $25,000. That's a lot of money. Now, I know that medical tourism is really taboo. I did do a lot of research over the last 1.5 years, and I ended up going to Mexico and having gastric sleeve surgery. I still am wary about sharing that because, again, there's a lot of taboo. People think like Mexico, third world country. That's not true. I will tell you, I used to work at a hospital here locally. The care that I received there was way better than anything I would have received in the States. I know people who have had surgery, this same surgery here in the States, and they're in the hospital for like a day and then they get sent home. They had me for like a week and were constantly making sure everything was okay. My surgeon was checking in on me. I had a whole team of nurses. It was like a medical spa. And it was amazing. I mean, it was hard. It wasn't a vacation. It wasn't a walk in the park. For me, Stan enjoyed himself, but I cannot say enough good things about my experience and how well they took care of me. And I was really prepared to have complications, because with any surgery, there's a lot of risks, and you could not wake up from the anesthesia. I'd never been put under before. That was the first major surgery that I'd ever had before, and even that was minor compared to the whole gastric bypass, which I did not have. So all of that to say, I gravely underestimated the recovery process. I thought at least I could record videos, that I could sit in my bed if I had to, record videos and edit and all of that. No, it has been a journey. Today is Tuesday, and on Thursday will be 8 weeks. So actually, gosh, it's been a long time since I posted a video. I didn't intend for it to go this long. But when I was 4 weeks post-op, this is me feeling like crap. Welcome to my bed with COVID. This sucks. I caught COVID. I haven't been leaving the house. I don't know how I got it. We don't know. We can't know. It could have been anything. I'm not gonna lie. I try my best to be calm, to take care of my body, to rest, even if it was driving me stir crazy, because I'd already pretty much been in bed for 4 weeks. I had just that week gotten up, started to get energy, started to go on walks and things like that. I just joined a gym, and the next day started having symptoms. There's so many people who have ended up in the hospital, and talking to some people that I knew who knew people who were in the hospital and had siblings who passed away and all of that due to COVID. Although I never really had issues breathing, luckily, for me, it was like a moderate flu. I'm not even gonna say that it was severe. It is not the sickest I've ever been. It was not fun, but it was like a moderate flu. I was extremely lucky and blessed, and I know this is a taboo subject, think what you want. I did test positive. I went and got tested twice. I did the at home, and then I actually got tested at a facility. Think what you want. However you feel is perfectly fine, but this is my experience. I would love to tell you that I wasn't scared. As far as people could tell, I was fine.
Day 6, I think, being in the bed. This is getting old fast. Did anybody else have this? How is it for you guys? I know I'm really lucky. I haven't had most of the issues that everybody else have had.
Internally though, I didn't know what the next day was going to bring, because my ego and the fear in the back of my mind, there was an energy that I was experiencing and purging, and it was telling me that, well, this person who went to the hospital and is now dead, it escalated so quickly. So just because you feel okay right now doesn't mean that either later tonight or tomorrow you're not going to be in the hospital. And I would be patient with myself when these thoughts came up. And I would remind myself that I'm safe, and I would remind myself also that if it was my time, then it was my time. I worried for a moment that I might have got it traveling from Mexico. We're going to Mexico. Because I was 4.5 weeks post-op, there's no way. There's no way I would have had it for that long. It happened while I was at home. And if I were to guess, it was because my immune system was probably compromised, because I had just undergone surgery and my body was healing. And I was sending all of the resources to healing my body, that my immune system was not very strong. And then Stan caught it, and there's a little bit of age difference between Stan and I. He's still not in the high risk category, but it still scared me too, because that's my husband, and what if I'm okay, but what if he's not? And what does that mean if I have COVID and he has to go to the hospital and I can't go see him? There was just a lot that went through my mind. I did maintain peace through most of it, but there were moments. There were moments where I experienced fear. There were moments where I can't predict the future. None of us can. I didn't know what was going to happen. All I knew is that I had to do my very best to take care of myself, take care of my body, rest, force myself to get in liquids, force myself to drink protein shakes. When I lost my sense of smell and taste, thankfully it was only for a week. The whole process really was very gentle. It was more a mind game rather than a body game. But when I lost my sense of smell and taste, up until that point, I kept thinking, maybe this is just a flu. Maybe that was a false positive, because the test did say that it tests for a certain protein, not necessarily for COVID, that it couldn't detect between the protein and COVID, that if the protein is present, it's highly likely that I had COVID. That's what the at-home test said. So up until that point, I was still kind of in the back of my mind saying, like, I don't know. I never had a fever. I had body aches for about 3 days. I did cough, but I never had breathing issues. So I was just kind of going back and forth in my mind, like, do I really have COVID? Or is this a flu that just tested positive because it has the same protein? But when I lost my sense of smell and taste, it became real. And that was challenging, not because I lost my sense of smell and taste and everything tastes gross because I had no taste, but it threw me off in a way I was unprepared for. We take for granted our physical senses sometimes. And you'll know this, whenever we get sick, we understand this. But to hear, to see, to touch, to smell, to feel temperature differences, taste, these senses we rely on to navigate in our natural world, in the 3D world. When you lose one of those that you have, or two, that you have been relying on for so long, it actually triggered some anxiety attacks because it felt claustrophobic, if that even makes sense. I felt blind in a way. even though it was just smell and taste. You wouldn't think that it would have that much effect, but it did on me. And that's when things started to get real. And I lost my sense of smell and taste on day 6. Now I took a couple of clips along the way.
So today is day 7, and I lost my sense of taste and smell yesterday. And it has been very disorienting. It's really, really weird to go through this right after bariatric surgery as well, because there's still a lot of meds that I have to take, and you have to take a lot of those with food, but there's only so much food that I can eat right now because I'm still in the soft food stage. So my stomach is like tore up from all these meds and like barely being able to eat anything because I can't have any breads or anything like that. And so it's like dairy, protein drinks, which I will tell you, not being able to taste or smell is, I don't know if my dog's gonna go to the bathroom, what she's doing. Not being able to taste or smell with some of these protein things is a huge blessing, because I'm forcing myself to get some sort of protein that my body needs as it's healing, even though it tastes disgusting. If you haven't experienced this either, like, I know I'm smiling right now. I'm happy because I'm outside. This is the first time I've really, it's been like cool enough to come outside a little bit, and it's just making me in a good mood right now. But if you haven't experienced this, you can't taste anything. Like, literally things taste like nothing, but you can feel, or at least I can feel, when things are synthetic, and they taste gross because you taste all that synthetic sweeteners and things like that, which already I haven't eaten much over the last 5 weeks because of the surgery. So I mean, it's been quite the detox.
Usually when I was feeling better, but the bigger thing at the end is the loss of energy. I was so drained. I don't know how many clips I took, maybe 3 or 4.
Today is day 12, no. Today is day 11 of COVID, and I'm finally starting to feel more like myself. I'm starting to get my sense of smell back and my taste, which is really nice. Today it feels like fall outside, and it's just amazing. I'm just sitting outside and enjoying, feeling better, enjoying the sun and the blue sky. I don't even know if you guys can see. I've got some leaves falling on the ground behind me. I guess it's too bright. But today feels so much better. I feel much more like myself.
But those were just a few minutes through 15 days. And even after that, I just started getting my energy back maybe 4 or 5 days ago. I kind of had to force my way into getting back to work. So I wanted to let you guys know and just be real and be vulnerable of why I haven't been here, why I haven't been posting. Things will resume as normal now. I'm better now. I'm feeling great. I've lost 37 pounds. I'm, again, no longer hypertension, no longer pre-diabetic. I don't have heart palpitations anymore. I'm sleeping better. I don't have the pain that I had. So although I still have a long way to go on my journey as far as the weight loss and the PCOS side goes, I'm already seeing huge improvements with that as I'm working towards a healthier version of me, so that hopefully I can continue to show up for you guys for many years to come. I don't know if you have had a similar experience, if you've had COVID, or if you've had gastric sleeve surgery, or if you've had RNY, which is the gastric bypass, or if you experienced, like me, you had surgery and COVID, or a mixture of something else that was traumatic for you. But if you have, let me know below so that I know I'm not alone. But I hope this lets you guys know and understand what happened, why I haven't been posting. Know that I'm not gone. I am going to continue to post videos and normal schedule will resume. I love you guys. Thank you for being here. Thank you for watching this long video of me explaining where I've been and why. If you are interested in shadow work, let me just go ahead and plug my program here, or coaching. I have two different options. So like I said, my coaching program is for entrepreneurial moms, and it's essentially overcoming the blocks that hold you back from really just being your most authentic self. So if you have something that's holding you back that's fear-based, or imposter syndrome, or work-family balance, or you want to take your business to the next level but you don't know how and you're scared, or you're just trying to navigate what your next steps are, then that's what the Fearless Life Formula program is for entrepreneurial moms. But if you're not an entrepreneurial mom, I still serve people, and that's where I offer the one-on-one coaching option. So if you want to work on shadow work or healing trauma, if you are ascending and you would like assistance and just talk some of this stuff out, because it's wild, guys. This is wilder than the Wild West right now that we're going through. But I'm gonna leave a link down below in the description. Go ahead and click on that, and if you've never had a call with me before, you get a free 30-minute definition session. And essentially what we do is we define what your next steps are, what's gonna be the perfect thing for you, whether it's working with me or whether it's working with somebody else, or whether it's just kind of getting clarity on what your next steps are on your own. That's what we define in that call. If you have questions for me about the surgery or COVID or anything like that, again, comment those below and I'll definitely answer those. And I guess I will see you guys next time.